Welcome. I'm Nikki Young, Program Manager with the Child Neurology Foundation. Today's talk is part of our ongoing series on healthy epilepsy management. Each topic focuses on what we heard from our families and our partners as a top priority. Today, we are discussing special diets for epilepsy and why you may consider them. I'm joined by Dr. Jeff Buchhalter. Welcome. Thank you for joining me today. Would you mind to just share a little bit about yourself and your experience?
And thank you, Nikki, and thanks to the Child Neurology Foundation for asking me to participate in this educational series. I've been a child neurologist for about 35 years and was fortunate enough to train at a place that continued using the diet when many other places wasn't. Recently, I had the opportunity to run an epilepsy autism clinic for 5 years, so very much in touch with that population.
Great. Well, we appreciate your expertise. We're going to cover some of the kind of most frequently asked questions surrounding diet and epilepsy, but we also reached out to our audience to see if there was anything specific that they wanted to ask an expert about. So just to get us started, what are the diets that have been shown to work for children with epilepsy?
Sure. And I think that's a great question, and I'll get to it in just a second, but a little history first. Dietary therapy for epilepsy was described almost 100 years ago at the Mayo Clinic, where it's still in use today. And this was called the ketogenic diet. It was discovered by the observation that people who unfortunately were starving, in the course of starving, their epilepsy got better. So scientists try to mimic the state of starvation without hurting someone. And the observation was that these chemical substances called ketone bodies appeared in the urine of people that were not eating. And that's why it's given the name ketogenic diet. That diet is largely composed of fats with a little protein and carbohydrates. It produces the same ketone bodies in the urine that can be used to monitor it that were previously described. This all occurred in 1921 when phenobarbital was the only medication around. And so the ketogenic diet had thousands of people using it until the late 30s when Dilantin, followed by other medications, came on the market. And as we all know, it's much easier to take a pill than it is to do a diet, particularly a restrictive one. One of the reasons that the ketogenic diet survived to its current state, where it's actively used, is due to the Charlie Foundation in the United States and Matthew's Friends in the United Kingdom. These parent-run advocacy organizations really brought public attention to the ketogenic diet and brought a lot of research funding. So kudos to the parent community. The answer to the does it work is yes, absolutely. And it was something that really all of us practitioners who were trained in its use knew for a long time. However, it wasn't until around 2008 that the first randomized controlled trial, the same type that's used for new medications and devices, was done for the ketogenic diet. And it works just as well. So no question that is efficacious. The other thing just to mention is that other diets that are related to the ketogenic diet, such as the modified Atkins diet and the low glycemic index therapy treatment, are also effective.
So when should a ketogenic diet be considered, or one of these other alternatives that you've mentioned?
Yeah. So in the past, the ketogenic diet was used as a therapy of last resort and almost exclusively for children. But times have changed. And in the last decade, with the explosion of our understanding of genetic and metabolic causes of seizures, we've seen a significant change. There's now a discussion among pediatric epileptologists as to when the ketogenic diet should be used as first-line therapy. Not the last, but the first or even second. The one disorder with the greatest amount of evidence is the glucose transporter type 1 deficiency, GLUT1, where KD, ketogenic diet, is the treatment of choice. The barrier there is delayed diagnosis, which relates to genetic testing. The other disorders for which ketogenic diet should be considered either first or very, very soon are infantile spasms and so-called Dusa syndrome, myoclonic astatic epilepsy. But then you say those are relatively uncommon syndromes. What about the other forms of epilepsy? And there's, again, a robust literature in a whole bunch of seizure and syndrome types that says the ketogenic diet results in greater 50% seizure reduction in greater than half of patients, which means it works as well as any of the anti-seizure medications. One of the other considerations as to the when involves side effects, the other side of the effectiveness coin. If a medicine is producing unacceptable side effects, like vomiting or sedation, obviously you can't go up on the dose. So that's another time where the ketogenic diet should be considered sooner rather than later. And there's now openness to the idea that it or other dietary therapies should be considered after one or two medications fail if surgery isn't a consideration.
So those are really great points for when families should start to consider a diet change. So thank you for that. And one parent actually asked, she never really considered diet changes for her child with epilepsy. But she mentioned that she has a picky eater and also has some developmental challenges with her child, like autism. Do you think those situations, if you have a picky eater or children with developmental disabilities, can they do a diet like this as well?
Absolutely. And how do I know this? It's because, again, the literature, which now goes back decades, shows the ketogenic diet can be very effective for children with all levels of development, from the most neurotypical to the most intellectually disabled. And so that by itself is not a reason to not consider the diet. And it's sort of interesting that in addition to being efficacious for all levels of development, it's also efficacious for all types of causes of seizures. And this is really interesting because we're now living in an age where we want to have seizure medications tailored for a specific genetic mutation. And that's what we'd love to see. This is sort of the other end of the spectrum where we have a therapy that's good for all comers. Is it perfect? Not by any means, but it's certainly worthwhile trying. Parent asks a really important question about being a picky eater, or even more commonly, my child isn't going to like that. And I want to say that this is very much of a parental perception, not necessarily a child's perception. For those of you that have kids, you may know that some of them will just love picking up a spoonful of butter and please put it on a cracker. But those fatty foods, a lot of kids enjoy them. And there's even research that looks at kids' perceptions and parents' perceptions and discovers they're not all the same. So we shouldn't let our biases get in the way. And then there's this other issue of the difficulty of starting the diet in a picky eater. Traditionally, kids were admitted to the hospital to initiate the ketogenic diet, essentially get going on it over, a few days or a week. And that's still done in many places. However, there are now other options. If there are no contraindications, my preference is to initiate the diet at home. And that can be done via a great, dietitian and nursing support. It's much easier on the child and the family. There's also other diets that I mentioned, the low glycemic index therapy and the modified Atkins. Also, much less restrictive than the ketogenic diet. And so what some people are doing is you start with a less restrictive diet. If you get the feeling that it's having some good effects, then you can advance it to ketogenic diet as it's tolerated. So it's just a gentler way of doing it. And then there's the issue of autism spectrum disorder. And that's received a fair amount of attention in the research literature. And it's really a two-part answer. The first is, does the ketogenic diet work for seizures? And does the ketogenic diet work for any of the symptoms associated with autism? The answer to the first question is yes, it certainly can work to control seizures in kids with autism, and just like in anybody else. The answer to the second one is tougher, and there isn't a lot of great research on it. So I will say completely anecdotally and based on discussions with other pediatric neurologists, sometimes a ketogenic diet can result in reduction in things like irritability. So much so that in my practice, some parents refuse to come off it, even though their kids' seizures were no better. Again, I'm just giving you personal experience, and firm research for that isn't available.
Well, thank you, Dr. Buchhalter, for all of this information. It's wonderful to learn from you about diets, special diets that families should consider. For more resources, check out Child Neurology Foundation's website at childneurologyfoundation.org. Together, we are all child neurology.